what I really want to do is hand over to Lynne, who is now going to sort of talk a bit about sort of self-management from her own point of view and the work she's done. So Lynne, over to you.
Thanks, Jim. Thank you. I think before I start, I need to sort of think about what self-management is, what does it mean to me? And I think one thing that I really believe is that self-management is the usual care. If you live with a long-term condition, you self-manage 24 hours a day on your own. Mostly you do get some support from health professionals, but usually it's you on your own with your friends and family around you. So self-management is usual care. Oh, I suppose I need to tell you that I live with MS. That might help, mightn't it? And I don't just live with MS, actually. I also live with hypothyroidism and familial cholesterolemia. So I live with 3 long-term conditions, 2 of which really do not have an impact on my life, and I can manage them medically by taking medication. Obviously, I have to take that medication as prescribed, so that's important, but I really manage those 2 conditions medically. MS, on the other hand, I can't really manage it medically because I have a useful understanding of it and how it impacts on my body. But generally speaking, the way I manage it is mostly through the social and the emotional aspects of my life. So it's about being willing and able to make adaptations to the changes that are happening to me. So, for example, I have had to learn to drive with my left foot. I drive an automatic car, but because my right leg is affected, I was no longer able to move my foot from the accelerator to the brake. So I had to learn to drive it with my left foot, which took some doing, but it was okay. I managed to do it. And now I don't think I could drive with my right foot at all. And then there's the emotional aspects of living with MS. So knowing that MS affects the way I feel, it makes me frustrated at times. Sometimes I'm fearful about what the future holds for me. I'm sad, and I'm not necessarily angry so much these days, but in the beginning I was angry, and all those emotions affect the MS as well. So how I feel affects the MS, and the MS affects how I feel. It kind of interlinked, and it's about recognizing that link. And if you do recognize it, then that's when you can start to deal with some of those things that you're feeling. So that's a biopsychosocial model, and it's about those things are going on all the time, and I kind of think of them as balls that I need to juggle. When I'm self-managing optimally, all of those balls are in balance and I'm feeling really good and in control. And that's that little white triangle in the middle where I can tell that things are going well. My life feels really good. Can we go? So I feel like I'm juggling those balls, but at the same time, I've not just got those 3 balls to get on with. I've also got all the balls that everybody else has with their everyday life. And I often think about the MS and think of it as something that I have to live with. I don't ever say that I suffer with MS because actually I don't think I do. I live with it though, and it has a big impact on my life. But I feel okay these days. I'm kind of confident. I feel that I know how to juggle my life with the MS. I have the skills. So we often hear about self-management being about knowledge, skills, and confidence. And for me, it's about I know how to juggle. I've got the skills to juggle. And I've also got the confidence to know that if I drop a ball, I can pick it up again and start again. And this can be kind of measured, the level that somebody has, the knowledge, skills, and confidence that somebody has can be measured using something called the patient activation measure, which hopefully some of you will have heard of. I've kind of shown it in this diagram. It's something that was developed by Judy Hibbard in the States, and it's a licensed thing that you can use, and it's just a series of 13 questions, and from answering those questions you get a level of that as a measure of the knowledge, skills and confidence of somebody to self-manage. Because as I said, self-management is usual care. We're all self-managing. It's not self-management, it's about how we do it. And you can see there that somebody who is starting out, somebody at level 1, sees their own role as important. They're very passive. That was me when I was diagnosed. I absolutely felt like spinning out of control. I wanted the doctors to make me better. I did not feel that I could do anything. I was totally passive. So when the consultant that diagnosed me when I was 34 said to me, go away and get on with your life, I couldn't do that. I woke up every morning and MS was there at the beginning, at the front of my head, and I was definitely, I would say, suffering, but I wasn't really ill. I just could not. So that's kind of the emotional bit, isn't it? So how did I obviously moved from level 1 to level 2, and when you do a PAM, some people will be at level 2, so they're beginning to know, they're beginning to shape their journey. I knew that I had to do something. I remember the day it happened to me. I'd been in level 1 for 2 years, but then I had a relapse and I was lying in bed, couldn't do anything, and I just suddenly realized, actually, the doctors don't know how to cure me. I need to do something on my own. So it became important to me to do something. As I lay there on my bed, not being able to walk, thinking, I've got to do something. I had no idea how to do it or what to do. But luckily for me, I enrolled on a self-management program, which became the expert patient program. And I did that course for 6 weeks, listening to the 2 tutors, and something began to change. And also other members of the group, everybody in the group lived with a long-term condition. They were all in the same position as me, and we learned together, and my confidence started to grow, and I just felt I could feel the change. And then somebody at level 4, some people are at level 4, they see their own role as most important. They have a range of strategies to self-manage. What I think I'm really good at is problem solving. I take an active role in anything that's going on for me. I work in partnership with the health professionals that I see, and I feel completely in control. Those 4 levels are summed up in the next slide. So it's almost like as you're moving through the levels of activation, I feel it's like you're going up and down steps, and you are going up and down them, because even though you might get to level 3, doesn't mean to say that you're always going to be at level 3, because your confidence is easily knocked back and you might move back to the step 2. I think now that I'm at level 4, I don't think I'll ever go back to level 3 or level 2. I think I'm okay. I've been here quite some time, and I'm not going to move. I'm staying on that top step. So how have I got there? And as I said to you, one of the biggest things for me was enrolling on a patient program, an expert patient program, being within that group, learning from others in that group, that peer support. And the things that helped me was learning to goal set or action plan. So setting small achievable goals that improved my confidence. the important thing about when you set a goal is to follow those goals up and learn how to problem solve when you're finding it difficult to achieve that goal. If you can problem solve and find your own solutions, that will help. And then I learned later on about agenda setting, about shared decision making, about making sure that when I have a healthcare appointment, I prepare for it. I know what I want to talk about, and I have things on my agenda that I want to talk about. So all of those things are enablers to self-management. And I was, as Jim said, I was involved with a brilliant demonstration project that the Health Foundation ran, which was called Co-Creating Health. And that was about the activated patients working in partnership with clinicians that are trained to support self-management. And whilst working on that project, I was involved in writing the self-management program that was used during Co-Creating Health. So I have seen thousands of people go through that program and seen the change that happens in their life. And it's been a real privilege to see that and know that I played a role in that. And I do know that the program is still running in certain places and it's still available. I'm sure Jim can give more information about that, because actually I'm about to retire. So don't come and ask me to run any training courses. But I'm sure that there are people that can do that if you're interested in knowing how and where to access self-management programs, because I think it's been the biggest part in bringing me where I am today. Do you remember when I was at level 1 and I was first diagnosed and I was looking to the health professionals to fix me and to give me the solutions and tell me what to do? Because that was me as a passive recipient of care, and I've changed because I've become more active in my role. And now when I see a clinician, I want that clinician to be an enabler to support my self-management, to problem solve with me. Because to be honest, I only ever go and see a health professional when I've really hit a problem that I can't find a solution to. I might have been to friends and family to find a solution, and we've come unstuck. So I go and see a clinician and hope that I'm going to get some support with problem solving. And I want them to see me as an equal, work in partnership with me, and work with me and not for me. So yeah, so I'm sure Andrew will take that up. So I want my clinicians to act as a coach to me. But it is a two-way thing. It needs me to be prepared, go in and do some preparation and know what I want to talk about. So it does mean that we both have to do a bit of work.
Thanks, Lynn.
Is that okay?
Can I ask you a question? Self-management courses, obviously, sort of things like the expert patient program have moved on. Programs such as Co-Creating Health were, generated a huge amount of evidence and expertise. And you just described for you one of the key processes which enabled you to have the confidence to manage your health and make that shift was being in that structured group environment over a number of weeks.
Yeah.
And it seems to me, looking around, that self-management courses, these semi-structured courses, have sort of gone out of fashion a little bit.
And I've said about that.
Yeah, they're deemed as sort of a bit expensive and this sort of thing. So what would you say to really sort of make people think, actually, we should really consider ensuring that we are running these courses? What do you think is some of the unique elements of these courses which make them so powerful?
It's the lay-led nature of them. It is about learning from people like you who have been where you are, but maybe just a bit further on. I would say that the biggest thing in my life was attending that expert patient program, and then learning to, and then becoming a tutor myself, because I didn't stop there. I went on to be a tutor and then an assessor. So, you know, I've watched and seen those groups, and I honestly say that those groups change people's lives in a way that I've not seen in other way. You know, I do believe, and it's sad, it saddens me to think that they are not available to anybody who wants to go on one. Agree, not everybody wants to be in a group, but for some people it's the answer.
And Lynne, from your experience as a tutor, I mean, you come over as a articulate. What about people where English isn't a first language, or learning disabilities where language is a barrier? I mean, are they able to participate in these groups? How do we manage that element?
I have been involved with training people. When I worked in Northamptonshire, I trained people from the Gujarati community to deliver self-management programs. And what it took people, did take people who had some command of English to come and for themselves to train as tutors, but then they went out into their community and delivered a course in the language for people. And I have seen it. I have seen it transform in all sorts of different languages. It does work. It obviously takes time, but it's not impossible to do. People would also say to me, yeah, it's all right for you. You've got a degree, you're articulate, you know, actually being intelligent and articulate didn't stop me being at level 1. And I think it's really important to bear that in mind. And I have seen people, when we did co-creating health, I remember training people to deliver the self-management program who had no qualifications at all, and they were fantastic tutors. They couldn't spell, it didn't matter. We trained them to deliver that program, and they had a huge impact on people, because, you know, it isn't about being the brain of Britain. It's about having empathy and being trained in the right way by the right people.
Thank you, Lynne. So,
but yeah,
there's a real principle.
I do think,
yeah.
I'm sad that they're not available to everybody.
Yeah. So this whole thing around training peers from the group of people, so that they're seeing people like them leading the courses up at the front from their community, from their background, with their beliefs and values, who've been on that journey and facilitating those courses. Thank you.
Yeah.
Lynne, that was brilliant. Thank you ever so much.
You're welcome.